Annabelle Lincoln, and along with Cheryl Lloyd, I am a co-founder of Pathways to Trust. We are a rare disease, nonprofit patient advocacy organization that was founded in 2020 to put the rare disease patient's voice at the center of healthcare treatment conversations. Cheryl and I have trained healthcare providers in communication for years, but we realized that what was missing in traditional education was the patient's voice. What does the patient really want? What are their goals? Sometimes that's different than what the providers think those goals should be. So we wanted to form an organization where the patient would be heard. So we started with rare disease because those patients are often not heard. Their diseases are not as well understood by the healthcare industry. And we started with sickle cell disease because those patients have a triple barrier to accessing care. First of all, they're a rare disease, so providers don't know much about it. Second of all, sickle cell disease affects people of color mostly, and the racial bias in healthcare makes obtaining appropriate care challenging. But what makes it even more challenging is that a big part of the correct treatment of sickle cell disease involves prescribing opioids. And in the wake of the opioid crisis, that gets very difficult to do. Providers are worried about it, about losing their license, and they are suspicious of many sickle cell patients, thinking that they're drug seekers. So we started with sickle cell disease to make sure that those people had a voice. We expanded to connective tissue disorders like Ehlers-Danlos because they also faced multiple barriers to care. Connective tissue disorders mostly affect women, and there's a gender bias in healthcare as well. The predominantly male industry discounts anything women say, and when your connective tissue patient is a child, and the child's biggest advocate is the mother, of course, the mother is either dismissed as hysterical or actually accused of medical child abuse. And many of these families have been torn apart because of that. So those are the two groups that we focus on. We train healthcare providers in not only the clinical, medical aspects of these diseases so that they can come up with a good treatment plan, but the other aspects that impact health. Things like finances, things like getting a job or an education, things like transportation to appointments, things like social stigma and difficulty maintaining relationships, so that these providers can have a 360-degree understanding of what these patients deal with in their lives. We also provide services for patients. We have workshops on planning your finances when you have a chronic and volatile disease, on dating when you have a chronic disease, and other issues that affect your daily life. So if you're interested in learning more about Pathways to Trust and what we do and how you can help us do what we do, please visit us at www.pathwaystotrust.org. And you can also find us under Pathways to Trust on Facebook, LinkedIn, and Instagram. Thank you.
Thank you so much. Injustice at BrickCity, and we're here today with Pathways to Trust at the Newark Museum. As you can see, we're here, and we're also tabling and providing information. So thank you so much for taking the time to speak with us.
My pleasure. Thank you for listening.